Hi everyone, welcome to my channel. If today's your first time stopping by, my name is Stephanie. I am a BSN-RN, and in this channel I talk a lot about nursing, hygiene, beauty and everything that makes me feel fabulous. If you like this content, please consider liking, sharing and subscribing to this channel, and I promise there's going to be much more of these videos coming your way. Today's video is going to be a question and answer session. Questions I have gathered all through my journey as a nurse. I have had so many people reach out to me and ask these questions. So I'm going to be reading them from this sheet and answering them directly to you. I actually have 20 questions, so just bear with me. The very first question is, what inspired you to become a nurse? I became a nurse because I feel that I'm a very caring person. I like to show empathy to people who need or who deserve the empathy. I love the fact that I am there for someone when they need me most or when they feel helpless. So that was one thing that pushed me to be like, hey, let me help people who are sick. Most of these people do not have someone to help them, maybe with their medications, help them understand what is going on with their health. So yeah, that is where I come in. I just like to be that person who is going to help them, walk through their medical diagnosis. The second question is, what's a typical day like in your nursing career? So I work as a nurse in the hospital, and for nurses in the hospital, typically it's going to be 12-hour shifts. Yeah, I do understand that other hospitals might do 10-hour shifts, but for me, I do 12-hour shifts. So I work 3 days in a week and I have 4 days off. That gives me a lot of time to run my errands, check on family, friends, finish up on anything that I need to do. If I have to go to any office, doctor's office, to do some documentation that falls within office hours, then that is when on my off days I get to do those things, go to the gym, the mall, try to catch up on all those things that would calm my nerves down. So aside from going to work, I just sit at home, watch movies, try to relax, reach out to family, catch up on what is going on with them, and typically that is my own, schedule for my nursing life. The next question is, what are the most challenging aspects of being a nurse? I want to say sometimes you feel that you're doing your best, but maybe your best is not enough, in the sense that you might be caring for a patient and you just want to feel like if you might kind of heal them, so to speak, but then you can only do what you can do. So for me, one of the challenges that I get is when the patient is really sick and I'm giving everything that I have, my care, my empathy, being there for them, supporting them, giving them the attention, answering all their questions, but yet again, there's nothing I can do for them medically. So that is one challenge that really gets to me. Question number 4, how do you manage the emotional toll of dealing with patients' suffering and loss? I try to put myself in their situation, and I try to ask myself, like, if I were in their position, how would I want to be treated? And I try to give them all that I can. I try not to overwhelm myself emotionally. I always remind myself that I am that person that they should run to when they need the emotional support. So I try to be strong for myself as well as try to be strong for them. Educate myself on how to help them navigate through the dying process or the grieving process, and to also be in touch with my humanity to say, hey, I'm also human, but again, I need to be strong for my patient. The 5th question is, can you share a memorable or inspiring patient story from your career? This is a very interesting one, patient story. So I remember I had a patient who had to go for a liver biopsy because there was suspicion of maybe a liver cancer for this patient, and the patient was very bubbly, very happy. So when they came to pick up the patient for the procedure, patient has signed the consent and all of that. The patient came back, I think 1-2 hours later on, and when it was, I think, like 4 p.m. medication, then I used to work day shift. When it was time for their 4 p.m. medication, I walked into the patient's room to check their vital signs, because I actually had a blood pressure medication, or I think a blood insulin to administer to them. So when I walked into the room, the patient was kind of very quiet, so that got me worried. And this patient was kind of confused because he was always trying to get out of bed. So there was a video monitor in the patient's room, just in case the patient tried to get out of bed. I will be, you know, kind of notified, so that we can prevent the patient from falling. And when I walked into the patient's room, the patient was still, the patient was quiet. I kept calling the patient's name and he was not saying anything. Long story cut short, the patient, I had to call a code blue on this patient, you know, and we revived the patient. The patient got intubated, went to the ICU, and I think 5 days later on, the patient was better, was extubated, and the patient came back to the step-down unit. He quickly remembered me, and I remember his girlfriend was at the bedside, and they were so grateful, you know, said how, I guess, I was the last nurse he saw before he was intubated, or when he woke up when he was extubated. So he was like, he knows that I was the last nurse who took care of him. It was so nice, so touching to see that the patient could remember that, hey, we were actually doing great job and, you know, great things to actually, you know, save their lives. So that was a story that really touched me. The next question is going to be, what advice will you give to someone considering a career in nursing? Nursing needs a lot of care. It needs a lot of empathy. I am a very empathetic person. I am a very caring person. So I would advise that you should be very caring. I would advise that you should make sure that it is a calling, that you are, you know, you are destined for nursing, because I will tell you that there have been so many nurses who have seen blood, who have seen poop, urine, and they've actually flared up and they were like, I don't think this is for me, and they dropped out of nursing. So before you get into nursing, make sure that the things that entails nursing are things that you're comfortable with. Make sure that in an event that the patient has to die, that you can control your emotions as well as be there for the patient and the patient's family. So yeah, just give yourself a self-check, ask yourself questions to be sure that you're getting into a career that is going to be fulfilling for you. The next question is, how do you stay updated with the latest medical advancements and practices? For me, this is simple. I like talking with my co-workers, my co-nurses, co-respiratory therapists, the physical therapists, occupational therapists, the doctors also. You know, kind of ask them questions. Like if you see something that, you know, you saw online, or something new in a patient's room, you can as well ask the patients. Most of the times the patients will be very knowledgeable on what they've been using at home. They can explain and even teach you. Yes, I've had patients who have taught me certain things that they have been doing for a very long time for themselves at home. But again, you can always ask your medical, you know, the other medical personnel, and they can be able to explain things for you. Another thing too is, you know, be open to reading, studying, reading papers, journals, you know, sometimes even Googling, watching YouTube videos. That is how you can keep yourself abreast with the technology, the advancement that is coming into the medical field. The next question is, what's your favorite nursing memory or achievement? To me, I always feel very fulfilled when I know that a patient was this close to, should I say dying, or this close to getting into a much more higher acuity. Take for example, let's say I walk into a patient's room and the patient's vital signs were tanking, or they were going in, you know, they were going downwards. I feel fulfilled when I call that code and the patient, you know, everything is done during the code to survive this patient, and the patient is taken to the ICU. It's always fulfilling to know that, hey, I walked in at the right time. I was there to help the patient when they were almost giving out in terms of life and death. It makes me feel fulfilled, and there is no joy that I feel when sometimes these patients will reach out to you. They will send you cards, flowers. Sometimes they will even come to the unit and even, you know, come to say thank you in person. Yeah, it just makes me feel so happy that I was able to put a smile on their faces. Sometimes patients don't like being in the hospital, and the more you can do for them to make them feel better and go home, they are so happy to get out of the hospital, and you don't know how fulfilling that is to me. The next question is, how do you handle difficult or demanding patients and their families? To me, I just like asking them directly, hey, I know you like asking your pain medicines, like, how would you want us to navigate this 12-hour shift in terms of giving your pain medicine? Sometimes the patients will be like, hey, can you give it to me every after 4 hours? I know it is every after 4 hours, and I just like to be on top of it. If I feel like they like to eat a certain things, I just like to make sure that that thing is already in the fridge, where whenever they call for it, I can just quickly go in there and give it to them. So basically just communicating with them, also with the family. Hey, are you comfortable? Is there something you want? Do you want coffee? Do you want orange juice? Something. Just make them comfortable. Bottom line is just make the patients comfortable, make the family comfortable. If they need something, just make sure that you're proactive instead of them always calling. One, they'll be very grateful that sometimes when you're walking in with the thing that they are always asking, even without them calling for it, they are very happy. And sometimes they will actually show appreciation. They will smile. They would ease up. You know, they'll be comfortable and maybe just sleep and, you know, let you do your thing. The next question is, what are the key qualities or skills that make a great nurse? I would say communication. I would say empathy. I would say care. Be there for them. Be knowledgeable on the medications you're giving them. Be knowledgeable. Try as much as you can to be knowledgeable on their medical diagnosis. Try as much as possible to know what to monitor in terms of the patients, whether the vital signs, the labs. That would make your day, you know, go smoothly. You won't want a situation wherein the doctors might come and they are very angry because, hey, a lab value was this, and you didn't, you know, call them to make them aware so that they could promptly treat the patient per that scenario. So try to be knowledgeable. If your IV skills are poor, try to, you know, maybe reach out to your manager and explain to them something. They might be able to work out something to help you. If you feel like you cannot insert Foley's, if that is your weak point, when other nurses are going to insert Foley's, offer to be the one to help them do it. Like, try to be proactive. That will ace up your A game. If you feel like, hey, you've never started a feeding pump, reach out to other nurses and be like, hey, I've never done this. If anybody is going to be doing this for any of their patients, let me know so I can, you know, either come and do it or I can come and watch them do it. That is going to make you feel more confident in your skills and make you feel more confident when you're doing something for a patient. The next question is, what is your favorite specialty in nursing and why? Look, I am so grateful I am a step-down nurse. I love the fact that the patient ratio is 4:1. I love the fact that the patient acuity is high, but not as high as ICU. I love the fact that I have to use my critical thinking. I love the fact that pretty much you're there when most of the times the patients are kind of frantic, they're kind of anxious as to why are they in the step down, why are they not maybe in a more laid back like med surg. You know, you explain to them. And I love the fact that in the step down unit also we have like we have more equipment to monitor our patients more accurately. Not so much as ICU, but much more than med surg, because on the step down unit you have telemonitors that will monitor their heart rate. We have the monitors that automatically take their blood pressures, temperatures, and all of that. So that makes work kind of a little easy. And it gives you a real-time number of what is going on in terms of the patient. I also like that when the doctors are coming around, you see like specialty doctors coming around, like the respiratory doctor, you see the neurologist coming around. Sometimes you chit-chat with them, sometimes they will teach you, you can ask questions, they will answer to you. I love the variety of the specialties that come around, you know, in that are involved in the care of this patient. The next question is, how do you balance your personal life with the demands of your nursing career? I want to say that I'm an expert in separating my personal life from my nursing career life, because whenever I walk into the hospital, like the very first door, I always tell myself, hey Stephanie, this is you walking into the hospital. Whatever is happening at home stays outside this door, and now you should wear the cap or have the mentality of, hey, now it's all about my patient. So I strictly know how to say this is work and this is my personal life. In as much as sometimes, you know, some things during work might trigger you to think of your personal life, I just try to occupy myself, maybe talk to other nurses, maybe go chit chat with the patient, just try to wind down to make sure that it keeps your personal life separate from your nursing career. The next question is, can you offer any tips for managing stress and preventing burnout in the nursing profession? One thing I'm going to say is the way I prevent burnout is on my days off, I really take the time to relax. I watch a lot of movies, read books, visit friends. I go to the mall, go buy stuff, eat healthy, drink healthy, get enough rest, reach out to friends, family. Just do the things that make you happy, that would ease your stress, so that the next time you're coming to work, you feel refreshed, you feel new, you feel brand new, you feel energized, you feel strengthened. So those are the things that I do to be able to, keep me up and alive for my patients and for my next schedule or my next working day. The next question, question 14, is going to be, what is the most important lesson you've learned in your nursing career? I would say care and empathy, but most especially empathy, because you come across patients who are helpless, they depend on you. It is up to you to put yourself in their position and say, hey, these patients are actually helpless, they are looking up to me, I am their go-to person, so I should be able to do my best to make them comfortable, to make them happy, to make them heal faster so they can go home. So that is one big thing that I've learned, empathy, especially empathy. And yeah, I'm also going to say communication, whether to the patients, the family, to the doctors and the other specialty professionals, as well as your co-workers, and everyone involved in the care of the patients. Communication has been a key thing, but I won't leave out the skills aspect of it. I have learned a lot. I have grown to being a much more confident nurse than I was 3 years ago. I always say this to new nurses that, hey, don't look down on yourself when you're just starting, because we have all been there, and you will get to the point where we are with time. So it's a thing of maturing with time. As time goes by, you become better at inserting Foley's, starting IVs, starting a feeding pump. You become better in PICC line, giving IV antibiotics and all of that. So yeah, time has been something that has made things better for me and my confidence level. The next question is, how can nurses contribute to improving healthcare and patient outcome? I would say we should be more empathetic towards our patient. We should show the care. If there is something that we need to do for our patients, we should, very much so do them for our patients. If our patients need their pain medicine, to give it to them. If they need food, if they need you to call family, let's just try to make them comfortable, because I also believe that the more you're there for your patient, the more you speed up their recovery process so they can go home and be with family. And yeah, it's going to make the place or make everyone happy. The next question is going to be, what are some common misconceptions about nursing that you would like to address? Most people think that nursing is more about just giving medications to patients, but I can tell you that there's so much more than just giving medications to patients. Aside giving medications to patients, we also make sure that their homes are safe for them. We also make sure that, you know, they have the access to, you know, water, electricity, everything that will make them comfortable back at home. We also make sure, you know, that they are well grounded spiritually, because in some certain cases we will call the pastors to come and preach, you know, to come and pray with them. We also make sure that, you know, we are there for them. We explain things to them. Definitely, obviously, we care for them, give them their medication, explain things to them, give them patient education. You know, we are just kind of like making them comfortable. The next question is, how has the nursing profession evolved or changed during your career? I would say there have been new things that keep coming up, especially when it comes to patient safety. You know, there's so many gadgets or equipments that come up with preventing patients from falling, patients from, you know, being able to reach out to the nursing staff. You know, we've seen more upgraded IV startup kits, IV equipment. We've seen different kind of pills and how medications now come. You know, technology has been amazing. The documenting systems that we use are becoming evolved, from the paper to now computer based, and it's even getting better. So yeah, the evolvement in the nursing or the medical field has been mind-blowing. It has been very impressive. I see even better things in the days ahead. The next question is, what's the most unusual or unexpected situation you've encountered as a nurse? So I know that one thing that I was taught as a nurse is we don't take gifts directly from patient or patient's family. That is something that should go to the charge nurse and, you know, shared amongst us as the nurses. I remember one time I had to come give a patient's medication. Then I was working as a night shift, and this patient, you know, during shift report, I met his daughter and the wife. But when it was time for their 9 p.m. medication, obviously family had gone. So when I gave him his medication, patient was fully oriented. He knew where he was and everything. So when I gave him his medication, he was insisting that I should take the envelope that was at his bedside. And I kept explaining to him that, hey, it is not allowed, or it's professionally unethical for us to take things from our patients or from the family. And he said that he didn't know that, because every other nurse and every other person that has taken care of him has been taking the envelope that they've been given. So that was just something that was very unusual, because I felt like, well, this is something that we have been taught in nursing school, you know, so why would others be breaking that ethical code of conduct? It was mind-blowing to me, because when I told him I wouldn't take it because it's unethical, he said, oh no, the other nurses and other people have been taking it. Besides, his daughter and his wife are aware of it and they agree to what he's doing, you know. So I was like, this is just not so right. Like, this is just not so right. So long story short, I had to bring it up to the charge nurse and the house supervisor, and they followed up from there. And, you know, they kind of validated the fact that the patient was fully oriented and knew what he was doing. So administrative wise, I guess they did what they had to do in terms of situations like that. The next question is going to be, can you explain the importance of continuing education and professional development in nursing? I feel like this question is repeating itself, but I will just echo it again. The necessity of continuing education is that the medical profession is evolving. So it will be a good thing to keep yourself abreast with the new technology, the new advancements, you know, the new equipment and everything that is coming in place, because you wouldn't want to walk into your patient's room and the patient kind of senses that you don't even know what you're doing, or you wouldn't want to be that nurse who is always asking questions. So continuing education is very important, very vital, because it keeps you abreast with, you know, the new things that are coming up technology wise, treatment wise, medications and all that. 20th question and the last question is going to be, what resources or organizations would you recommend for nurses looking to grow in their careers? I think that this is an easy one, because the hospital in which you're established in, they should have some sort of a team or an educational, group of people who come together to train or answer questions with regards to maybe skills, knowledge wise, new things that are coming up. So I would suggest that you go to your manager, your director, the charge nurse, whoever might be involved, but please follow the chain of command and explain to them what your challenges, and they would, or they should be able to come up with, a solution to helping you out. So those were all the questions that I had, 20 questions in total. Thank you so much for staying right up to the end of this video. If you liked the video, if you liked the content, please consider liking, sharing, and subscribing. And from me to you, I'll see you in my next one. Bye guys, and stay safe.